Hi everyone, this is Erika Bennett with South Georgia Medical Center, and I'm here today with our President and Chief Executive Officer, Mr. Ronald Dean.
Good morning.
Good morning, Mr. Dean. We have been battling this COVID-19 pandemic now for about 5 months. Can you give us an update of what we're seeing here at South Georgia Medical Center?
Battling is the right word. It's a great challenge for the health system, the community, community leaders, the state of Georgia. It's busy. I think we're approaching 500 discharges now, 3,200 or so positive cases in the county. And I guess, Erika, if there's a silver lining, maybe we're being hopeful, I don't know. But it appears as though across the state of Georgia the curve is flattening. And that might mean that it's starting to slow down, this second wave, if you will. Inside the hospital, 63 patients are in the hospital, 62 are COVID positive, 1 is under investigation as we speak, and y'all know that changes at any given time. That's down from a peak of about a week ago. We had 77 that were either positive or under investigation. What has continued to increase is the number of patients being ventilated and the number of ICU beds being used. Right now, 27 patients are on a ventilator, 14 of which are COVID positive. Everybody knows those patients tend to stay a lot longer, and unfortunately, we've had an increase in mortality. I don't know where it's going from here. It might be that it's slowing down a little bit. We have had 4 or 5 days of declining census for COVID patients, but I think things are changing. We're going back to school. We've got a lot more activities in the community, but I will say I think what everybody's doing, our educational leaders, our academic institutions, our business leaders, what we're doing with the mask is working. It's slowing it down, I think. And what we're going to do is prepare for the worst and hope for the best. Team's doing an outstanding job managing the capacity. And just remember, everybody, COVID patients make up about a 4th or a 5th of our total patient census. So we do have this other large patient volume that's coming in, and that is putting some strain on our capacity, but heretofore we've managed it very well. A credit to the team.
How is the team doing?
Well, again, they're tired. I mean, I can't say it any other way. They're working really hard. They're stretched at times. We find a way to staff the units, Erika. We've found ways to open more units, but I think if we described it any other way than being, taxed or maybe even somewhat exhausted, that wouldn't be truthful. This team is working hard. Doctors, nurses, respiratory therapists, the entire team, and I'm very proud of them. Now, they're not asking for empathy. I'm just saying. Now, are we ready for more? Yes. Can we handle more? Probably. We're not out of capacity, but at times it has been tight. We've been able to manage all the patients that have come through our emergency room. We have not been able to take every transfer in from other areas, and sometimes we've had to put them on a waiting list. But I'll just tell you, I couldn't be more proud of this team. They're tough-minded, but it does wear and tear physically and emotionally, and we pay attention to that, and we want to do more for them, and we will, because they need us to be there for them while they're there for us.
Mr. Dean, where do you see this going from here?
I don't know, Erika. I can't predict it. No one can. I do think we're learning more about the virus. I think the end game will be perhaps when we're vaccinated, if there is a vaccine that works, if there are those that take the vaccine and it's pushed out. I think that's when we kind of get it under control, but it could be that we live with this for a long, long time. And I think that's why it's important to balance reopening with living with this new disease. Remember, I guess it was November, December, we just were learning about this. So we're only a few months into the battle. But I think the healthcare delivery system's figured out a lot. We put the remdesivir to work, the convalescent plasma program to work. More studies are coming out about other drugs. We've talked about the dexamethasone and other types of treatment. Our clinical teams have been on the front end of that. And I just think if someone gets it, I'm hoping that there's a higher likelihood of survival in those most vulnerable patients. And then for the rest of us, maybe it's not as significant to us in the long run. I don't know. I do think we should focus on these things. Let's prevent it where we can. We're sending our kids back to school. College students are coming to town. We welcome them. We want them to have a safe experience while at school. And I think the best way to do that is to do these things. Wear a mask, distance, social distance where we can, especially in quaint areas. We need to wear the mask, social distance. Wash your hands, don't touch your face, clean our surfaces. And I think that's what we prepared to do. All the educators I've talked to have prepared their classrooms for this. And as scary as it is, I think we're going to be okay, but we've just got to keep working at it, just like we do anywhere else, at our home, in the hospital, or in our business.
Mr. Dean, a few weeks ago we announced that we were launching a 10,000 mask challenge to purchase 10,000 masks to be given to people in our community that may not have access to them.
Yes.
Can you give us an update on that?
Well, the challenge has been met. We have ordered the mask. All the money has been raised thanks to our community partners. And I think it's going to be a great success, because just remember, some of us have access to these masks, others don't. And what we don't want is someone not be able to have a mask to protect themselves or others. Erika, if you remember, this idea originated out of our screening center. The Smith Northview Screening Center has been a wonderful success. 15,000 have been screened, over 10,000, close to 11,000 have received testing for COVID-19. We are seeing a lower positive rate out there. It's been as high as 29% positive, 16% positive in the latest report. That's good. That's another positive trend. But what we identified was a lot of folks would come through and they just didn't know how to get a mask, and can't afford it, don't know where to get one. So we're going to arm them with a mask so they can protect themselves and protect others. And I just want to shout out to that screening center team for the remarkable work they're doing out there. Doesn't matter if it's raining, if it's hot, if it's steamy and other things are going on, they're there. And then to all of our community partners that have helped fund this, a lot of money raised for a good cause. And I think it's going to make a big difference.
Absolutely, that's great to hear. Mr. Dean, throughout this pandemic, we have launched numerous growth initiatives to ensure that the community has access to specialty care here in our region.
Right.
Can you give us an update on any new information?
Sure. I mean, a lot of things are going on outside of taking care of the COVID patients. You know, when I arrived back in October, I heard the community talk about a lot of things. One they talked about was easier access to care. Let's add more physicians, meet unmet needs. We've done that. We've got more coming. But partnering with our local physicians was another priority, and the physician community asked that we respond to that, did that. And in this most recent announcement, we're pleased to tell you that the neurology practice that sits in front of Smith Northview is now a part of our South Georgia Medical Center physician network. That is a breaking story. Dr. Eisa, Dr. Posas, Dr. Patel, been in practice for a long time, great neurologists, great team of people. They provide a valued service, and now they'll be a part of our physician network in a formal way. And that only means that we're going to work together to be stronger. They do remarkable things out there, serve the community in a lot of ways. So we're partnering for those reasons, and that should equal better access to care. We should be able to grow from there, build the neurosciences program. You all know we've added neurosurgery. Dr. Khalil has been here. Dr. Mackey came, now partnering with neurology to further expand services. That's a way of increasing access to care. So very proud of that, very proud of that team. Glad to have them as a formal part of South Georgia Medical Center effective this week.
That's awesome to hear. They definitely have a great reputation in the community. So anytime we can partner to enhance access is a wonderful thing. So thank you for that. Is there anything else you wanted to share?
No, I just want to say one more time, thanks to the community for all you're doing. You've been very supportive, your kind words, the meals that have been provided to the team, the cards. You just really don't know how uplifting it is unless you're walking in the shoes of a nurse when they hear some appreciation, because remember, they come here to help people live, and unfortunately there is death and dying associated with COVID-19, and we can argue all day long whether it's a lot or not, but it is, and it does impact them, and your kind gestures of support really matters. Ask you to wear the mask, socially distance, clean your surfaces, wash your hands, don't touch your face. Let's continue to be vigilant about this thing, and I think we'll whip it. I really do. I think we're on the backside of it, at least this next wave.
All right, thank you, Mr. Dean, and thank you everyone for tuning in today. And just stay tuned to our website and social media accounts for the latest information, everything at SGMC. Thank you.
Thank you.